Hi everyone, I'm Dr. Madhumita and you know me as Medico Madhu. The recently famous topic, adult ADHD. Thanks to Fafa, since the day he has come up and talked about it, all of us are getting more and more information about it. So today I thought with all the celebrities contributing to the mental health for the community, why not as a doctor I also be a part of it and spread a bit of information about adult ADHD. You all know what ADHD is, attention deficit hyperactivity disorder. So, do all the people have it only in childhood and then it progresses to adulthood? Not necessarily. Of course, there are few cases of ADHD which are missed out in the childhood, which gets detected later on. But that doesn't mean everyone who has ADHD in the adult life had it in the childhood. We do see a vast number of cases where patients come for the first time with ADHD, and majority of the time they realize it not because of themselves but because someone else has complained about it to them, that they are inattentive when someone talks to them, or they are not able to meet their deadlines, or they are getting a lot of anxiety issue, temper tantrums, they are not having attention span, and they don't emote properly. All these are the common presentations in which they come to us with. This is associated with smoking or any addiction for that matter, not just smoking. Substance abuse is a common association that is seen. Anxiety is another thing. Mood disorder like depression, mania are also noticed. That doesn't mean every person who has ADHD has all these associations, but a vast majority of patients do have association with these things. So when we usually approach with everything, not just with ADHD alone. So we will be treating all of them. We tried to find what exactly is the reason for it occurring. We couldn't find anything. But on CT scan and MRI, there have been different lobes of the brain which have shrunken or the anatomy has changed. So we are not able to conclusively say that this is the reason why a person has developed it. Is it genetic? No. There are few cases where there is no genetic association. There are few in whom it is seen as well. And again, we check the neurotransmitters like dopamine, norepinephrine, some amount of relation where the hypo-functioning of these have been noticed. So we are majority, the treatment is based on these. So we are not able to conclude evidently that this is the only reason why it is seen. But definite association is seen. How do we classify them? Based on your symptom, you can be classified as mild, where the symptoms are at a level where it, like, on repeated forcing or on therapy, counseling, medication, patient responds better. Moderate is the inattention span increases, the aggressive behavior increases, the inability to complete a task, inability to coordinate, all these things increases. In severe cases, it goes to an extreme where the patient definitely needs complete medical therapy, complete medical attention, without which we are not able to handle. And in these cases, the anxiety, the depression, mania, and substance abuse is much more. So when we handle it, it is a diagnosis that is made clinically. We have a questionnaire. Based on that, we classify you into mild, moderate, and severe, not just by going for some blood investigations alone. Of course, we do check the blood and all for the markers like, substance abuse and all. So when we go for treatment, it is not just the antidepressants, it's not just the mood modulators, which helps in improve behavioral change medications that we give. Of course, tablets are one side, but we do suggest you to go for psychotherapy. First, we do a psychoanalysis, and then based on that, we give you a set of things to do so that your behavior changes. We give you in small models and try to achieve small targets, thereby making it consistent and a thing that you can do lifelong. Apart from this, if you're someone who has been addicted to some substance, then we of course refer you to the de-addiction center and get it treated as well. It is not as alarming. Once you get it treated, we can easily control it. And we can of course help you make good progress just like the children. So we don't have to worry if you're diagnosed with ADHD. The earlier you get it treated, the better your response is going to be. I hope this video was useful. I will be meeting you with many more informative videos.